Do your knees click or pop whenever you do workouts like squats or lunges? Or maybe when you get up from a seated position? What causes this, and should you be concerned? Let's talk about it. First off, what we're not talking about is cavitation. Cavitation is where nitrogen gas escapes the joints, creating a popping noise. Think about whenever you crack your fingers. No. There we go. I don't know if you can hear that very well, but think about when you crack your fingers or you go to the chiropractor and he gives you a nice back crack or neck crack. Number one, that's the most satisfying sound on the planet, but it's completely normal. What we are talking about is the various clicks and pops that happens whenever you do exercises, or it just seems like particular movements always make a certain joint, like your knees, crack every time. To get started, let's talk about some relevant anatomy. The quads are made up of 4 muscles, quad meaning 4. The main one we're going to talk about today is the rectus femoris. It runs right down here in the middle of the leg and actually connects to a tendon called the quadriceps femoris tendon. This tendon runs over the patella or kneecap and connects down here to the tibia. The bottom half of that tendon is called the patellar ligament. Fun fact, the patellar ligament is often referred to as the patellar tendon, even though it's not a tendon, it's a ligament. The difference between the two is a tendon connects muscle to bone, a ligament connects bone to bone. The more you know. And where the femur connects to the tibia, there's this little groove that the patella sits in. It moves smoothly in this groove as long as it's positioned where it should be. The cracking and popping comes when that patella isn't positioned properly in the groove, or more likely the quads or the quadriceps femoris tendon is tight, putting more pressure on that patella to sit deeper in the groove, adding additional friction. Another issue is if there's scar tissue from a previous injury or surgery. If that's the case, some simple massaging of the area should do the trick. If cracking and popping is not accompanied with pain, there's really no need for concern. But if there is pain, then you should contact a healthcare professional. Or it may just be as simple as a lack of mobility in the knee joint. Either way, let's get down to fixing the issue. We got 4 exercises today, 2 stretches and 2 strengthenings. The first one we're going to start with is a kneecap massage. And so for this, all we're going to do is we're going to straighten out our leg, and we're just going to move our kneecap around, side to side, up, down. A good healthy kneecap, you want some good movement in it. A good way to tell that if your quadriceps femoris tendon is tight is if your kneecap doesn't really move around or it's pretty stiff. That's a good indicator that it's tight, and this will help loosen it up. And for this, you'll massage it for a good 30 seconds to a minute. Now, if you tend to have loose joints, be careful with this one because you don't want to use your force and push your kneecap out of the way. So either way, if you've never done this before, go into it loose, go into it, really easing into more and more force. But again, you don't want to put a whole bunch of force into it, whether you have loose joints or not. The next stretch we're going to do is just a simple kneeling quad stretch. Move that more out of the way. All right. And so for this, all we're going to do is we're going to get on all fours, and then we're going to put our hands out, and then we're going to take our butt towards our heels. We're just going to keep our back straight, take our heels down, or take our butt down towards our heels, and you're really going to sit down in the position like that. And if your quads or your femoris tendon is tight, you'll really feel a good stretch in here, and then you'll come down, hold it for a few seconds, and then come back up. That's 1 rep, and you'll do 10 reps for, what did I write down, for a total of 3 sets. Also, a variation you can do is if it hurts your knees to sit on the ground or whatever it may be, you can get on a padded surface like your couch, your bed, and you can do the exact same stretch, and you'll really feel it the more you come back. I kind of even feel it right here, sitting like this. Now let's move on to the strengthening exercises, and the first one we're going to do is just simple wall sits. So all you're going to do is you're going to put your back on the wall, take your feet about 1.5 feet, 2 feet away from the wall, and then you're going to put them shoulder length apart, and then you're going to keep your head on the back wall as well. And then all you're going to do is allow yourself to slide down. And then you're going to sit in a seated position, whatever's comfortable, whatever's good resistance for you. And you're going to sit for 2 seconds at the bottom, slide back up, and then slide down again, 1, 2, and that's 2 reps. And you're going to do 10 reps for 3 sets. The thing I like about this exercise is you can adjust the resistance instantly. If you get here and you find all you can go down is just a little bit, well then stay there. 2 seconds, go back up. And then slowly work your way down to where your thighs are parallel with the ground and your thighs and your legs make a nice 90-degree angle. That's what you want. 2 seconds, and then come back up. The second exercise we're going to do is called yoga block squats. And this one's really nice. I like this one is because it's simple, it's easy, and really you can do it anywhere with very minimal equipment. So I'm using a yoga block here. I got this at Walmart for I think like 10 to 12 bucks. You can actually get a lot of cool exercise equipment at Walmart. It's pretty cool. Anyway, so all you're going to do is you're going to stand on it, and with one leg, and then with the other leg, what you're going to do is all you're going to do is bend down, touch your heel, and then come back up. And you're actually going to do this forward, sideways, and backward. You're going to do it for 3 sets total, and each direction, forward, sideways, and backward, you're going to do for 5 to 10 reps. Once you've done it all the way around, that's 1 set. And then you'll do a second set. So you'll do 5 this way, or 5 to 10, 5 to 10 out to the side, and then 5 to 10 out to the back. Now, if you want to increase the resistance and increase how tough this can be, take your other foot out even further. So then come out even further. Oh, almost fell. That way you have to squat down even lower, go out even further. That way you have to squat down even lower. And then this is good because it also strengthens your ankle and helps work on your balance as well. If you've experienced what I've been talking about and you fixed it by means other than what I've shown today, please let us know all about it in the comments below. You never know who's going to benefit from your story. If you want to burn a few extra calories right now, hit that like button below. But if it's bulking season, don't hit that like button. Hold on to all those extra calories you can. Please subscribe to the channel by clicking here, or if you want to watch my video about how to fix a clicking shoulder, you can click right here. Remember, what you think, what you eat, and what you do all create a life of chronic health. Thanks for watching, and I'll see you next time.